few weeks ago in late May, the Florida Department of Agriculture and Consumer Services, along with the University of Florida College of Veterinary Medicine, announced the first H3N2 canine influenza or dog flu cases in the state of Florida. Joining me now to talk about canine influenza is Cynda Crawford, DVM, PhD. Dr. Crawford is the Maddie's Clinical Assistant Professor of Shelter Medicine at the University of Florida College of Veterinary Medicine. Dr. Crawford, welcome to the show, ma'am.
Thank you.
So glad to have you. This has been a very interesting topic, and I actually saw today that this virus has been seen in several other states other than Florida this year. And let's go ahead and start with a little summary for the audience. What is H3N2 canine influenza, and what's the story on its history?
This is an influenza virus that started out as a virus that infected birds in Asia. And this avian virus over time started infecting dogs in Asia and eventually became adapted to the dog as a new host, meaning that it lost its ability to infect birds and gained the ability to infect dogs. Mm-hmm. And this was reported starting in 2006, and this virus is still circulating quite heavily in dog populations in particularly Southeast Asia, Korea, China, Thailand, and possibly Vietnam. So it was restricted to that area of the world until something happened in 2015, in March of 2015, when this virus all of a sudden was identified in dogs in Chicago. So somehow the virus got transported from Southeast Asia to Chicago, likely in the form of an infected dog that was still contagious, and that infected dog or dogs that arrived in the Chicago area then spread the infection to U.S. dogs. This virus is so contagious, and that it has swept through 30 states now in 2 years, infecting thousands of dogs. So very fast-moving virus, and until now, we had not had but one case of H3N2 canine influenza virus in this state. And so starting 2 weeks ago or so, we started detecting or diagnosing several cases, more than a dozen initially, and that number has climbed since then.
Mm-hmm. And like I said, I saw that there's about 8 states, most of them in the southeast, that are dealing with the outbreak right now. What is the latest on the situation right here in Florida?
Well, our first cases that we detected in Florida were show dogs that had recently attended a dog show in Perry, Georgia, before May 22nd. So the very first cases were those dogs that we saw here at the University of Florida College of Veterinary Medicine. Then we saw other dogs coming in infected with the same virus that had been at the dog show in DeLand, Florida. Mm-hmm. That was the weekend after Perry, Georgia. So it seemed to have started in the Perry, Georgia area and then spread with show dog movement south to Florida, and also the confirmed cases of H3N2 flu infection in other dogs in the other 8 states are associated with some sort of show dog or dog show connection. So here in Florida now, We are still identifying cases of infected dogs, again, mostly show dogs. But now it's spilled over into the pet dog population. So we have some dogs that are not involved in the show dog world. They're pet dogs that were boarding and were exposed to a show dog connection and have now acquired the infection themselves. So we have virus circulating in the show dog circuit, and we have now virus starting in the pet dog population in Florida. And this virus has also spilled over from show dogs into pet dogs in Tennessee and Kentucky.
Mm-hmm. Now, do you know off the top of your head, is there any cases right here in Hillsborough County where I air from?
Not to my knowledge,
okay.
No.
All right, so let's get into the disease, the infection's pathology. So how do dogs get infected? It's an influenza, so is it respiratory, just like a human influenza?
It is. It does infect the respiratory tract of dogs. Does not infect people, as far as we've known for the past 11 years. Dogs most dogs in the United States, virtually all of them, do not have pre-existing immunity to this virus. Mm-hmm. So if they're exposed to enough of the virus from an infected dog, they will get infected. It is spread by dogs that are suffering from an influenza-like illness from this virus. So that would be the same sort of symptoms that we experience when we're infected with human influenza. So that would be coughing, very frequent coughing, sneezing, runny nose for the majority of dogs. And then there's about 1 out of every 5 dogs that do develop pneumonia. Just like people can from flu, and this pneumonia can be life-threatening if the dog is not hospitalized and under veterinary care.
Now, of the cases that have been seen in this current outbreak, has there been fatalities?
There have been 2 reported fatalities in North Carolina, show dogs. So, yes, there have been fatalities. Again, fortunately, death is uncommon, mm-hmm. but the ones that are at peril for dying are those dogs that do develop pneumonia. And the pneumonia really can be very serious.
Sure. Now, you mentioned that it's not known to be transmitted to humans. How about other animals?
Yes, it is known to infect cats. It has infected cats in Southeast Asia, where it originated, and it infected cats in a shelter in Indiana shortly after this virus landed in Chicago. So cats are known to be susceptible to infection by this canine virus.
Mm-hmm. Is it a similar pathology as a dog?
It is. It causes respiratory signs like it does in the dog, but the cats generally don't cough. They do have the sneezing and runny nose, and they have somewhat of an odd behavior in the ones that were in the shelter in Indiana. They had a lot of lip smacking and drooling.
All right. What dogs are at the highest risk for contracting canine influenza?
Well, we're a dog-loving nation,
mm-hmm.
and we're highly mobile, and you put the two together, and dogs go with us everywhere, ever-expanding opportunities for our to take our dogs to various venues out in public. So most dogs have a very social lifestyle and interact not only with other people out in the community, but also other dogs. And it's that interaction or mixing with other dogs from different areas of the community and even from outside of the community that puts a dog at risk for exposure to the canine influenza virus. So I would say that dogs that are homebodies and have a yard that they go out in and walk around the block are low risk. But dogs that go to PetSmart, that go to dog parks, dog daycare center, boarding, any kind of dog show event, whether it's something like agility or whether it's an AKC-style breed show, are also at risk. As a matter of fact, I think the show dogs are probably one of the highest risk groups because that's where you have hundreds, if not 2,000 dogs mixing together every weekend, and they're coming from all over the United States.
Right. Now, is there a specific treatment for canine influenza? Is there the canine version of Tamiflu? Or?
Well, there is not a canine version of Tamiflu, no. So since this is primarily a viral infection, it pretty much has to run its course, just like influenza virus has to run its course in us. And we do need to provide supportive care for the dog if they develop signs of a secondary bacterial infection. So that would be an antibiotic to kill the bacteria. And then if they become dehydrated because they don't feel well enough to eat or drink, we may have to give them intravenous fluid therapy. And then, of course, if they develop pneumonia and have to be hospitalized, then there's all sorts of treatments that need to be used to stabilize them and help them recover.
Mm-hmm. Now, a lot of the updates and reports we're getting are from UF. Are you guys doing all the diagnosis?
No.
Okay.
We collect samples for diagnostic testing, but we submit the samples to well-known laboratories that have very good and accurate tests for canine influenza viruses. Mm-hmm. And so that's what we do.
Okay. And is it a respiratory sample? Is it a blood sample?
We have to actually, just like the physician does for people, we have to collect swabs.
Oh, okay.
And so that would be swabs of the nose and swabs of the back of the mouth or the throat area. And then we submit those swabs from the dog to the laboratory for testing for the actual virus itself.
Okay. Now, for the audience, if someone suspects their dog may be infected, Dr. Crawford, what should they do?
Well, so they need to kind of stop and think, okay, my dog has started coughing all of a sudden and is acting a little bit off, a little bit puny. I wonder if he or she has picked up the flu virus. Think about where your dog has been in the last week or two. Has it been around other dogs? Were the other dogs coughing or not? And the reason I suggest that owners stop and think about the recent history of where the dog's been is because that's exactly what the veterinarian's going to ask when the dog owner calls the veterinarian to say, I think my dog may have the flu. So the history of potential contact with other dogs is very important. And the owner should call their veterinarian first and describe what's going on. Mm-hmm. They should not get into the car with their dog and drive directly to the veterinary clinic and go into the front lobby area, because if their dog does have something highly contagious like canine flu virus, that dog will expose all the other dogs in the clinic, and it could start an outbreak actually in the clinic population. So the veterinarians will tell the owner likely to wait in the car with their dog, to call upon arrival, and they will give the client instructions on how they will see their dog in a manner that doesn't put other dogs at the clinic at risk for exposure.
Okay, good. Now, we're talking about H3N2 canine influenza, but that is not the only strain of dog flu. There's also H3N8. Much like in people, we have this alphabet soup of influenzas. Is there any significant difference between the two strains as far as symptomology or pathology?
There is. The H3N8 canine flu virus, of course, was discovered here in Florida, as a matter of fact, in 2004. It was the first time an influenza virus was ever associated with respiratory disease in dogs, ever. That virus has been circulating in dogs since 2004. It's been like in 42 states and also infected thousands of dogs. But its presence is somewhat low-key right now. So it's got little tiny pockets in various areas of the country where it's infecting dogs, but not to the same extent that H3N2, the newest virus to come to the U.S. in 2015, has been just sweeping around the country at lightning speed. The two viruses, even though their names sound alike, H3N8, the older one, H3N2, the newer one, they are totally different viruses. And they have some similar behavior, and they have some very key differences. Both viruses have a very high transmissibility, or as we say, they're highly contagious to most dogs. They both cause respiratory infections. They both can cause pneumonia. But the key differences are that H3N2, the newer virus, seems to make dogs sicker for a longer period of time and has a higher incidence of pneumonia than the older H3N8. And then there's the other key difference is that the dogs infected with the newer virus, H3N2, are contagious for up to 4 weeks, whereas dogs infected with H3N8 are contagious for a week at most.
Yeah, big differences then, okay.
That's a big difference. If you're an owner and you have a dog that's infected with H3N2 and you have to hold it in home isolation for a month, that's a long time for an owner to do so in order for their dog to clear the infection and no longer be contagious. It's much easier for a person whose dog is infected with H3N8, the older virus, to hold their dog in isolation for a week or 10 days.
Now, last question, Dr. Crawford, and that's concerning prevention. Now, like with influenza in humans, we have vaccines. I take it there's vaccines for dog flu, and there's probably separate ones for the two different strains.
We have separate vaccines for the two different viruses, and we also have a vaccine that has both viruses in it. So instead of getting two separate injections to be vaccinated against both viruses, you can now get one injection. The caveat is that when dogs are first vaccinated against canine influenza, they need to have a series of 2 injections in order to achieve the protective effect.
Right.
And then they would get a booster every year, just like we do.
Okay. And any other advice for prevention for the audience, the dog-owning audience? I
can't stress enough that vaccination is the most important tool for protecting your dog against canine influenza. The second most important tool is to be aware of the presence of either canine influenza virus in your community through media reports, through veterinarian reports, whatever. So heightened awareness. And then the third most important point is don't let your dog associate with dogs that appear ill.
Wow. This has been very interesting and very informative. I want to thank you, Dr. Cynda Crawford, for your time and expertise, ma'am. I appreciate it.
Thank you. I appreciate the opportunity.
You're welcome. Thank you.
All right. Bye.
Bye.